Hi everyone and welcome to today's video. In this video, we're going to be talking about urinary tract infections (UTIs). UTIs are a common type of infection that can affect anyone, but they are more common in women than in men. In fact, it's estimated that up to 60% of women will experience a UTI at some point in their lives. So, what exactly is a UTI and what are the causes? Well, a UTI is an infection that affects any part of the urinary tract, which includes the kidneys, bladder, ureters, and urethra. UTIs are most commonly caused by bacteria, such as E. coli, which can enter the urinary tract through the urethra and begin to multiply. UTIs can cause a variety of symptoms, including pain or burning during urination, frequent urination, and cloudy or strong-smelling urine. In more severe cases, UTIs can cause fever and chills, which may be a sign of a more serious infection. Diagnosing a UTI typically involves a medical history, physical examination, and laboratory tests, such as a urine sample. Treatment usually involves a course of antibiotics, and it's important to take the full course of antibiotics as directed to ensure that the infection is fully treated. In this video, we'll be discussing the causes, symptoms, diagnosis, and treatment of UTIs in more detail. We'll also be sharing some tips for preventing UTIs and reducing your risk of developing these infections. So, let's get started. There are many potential causes for urinary tract infections (UTIs) which could serve as interesting topics for a YouTube video. Here are a few ideas. Risk factors for UTIs. Discuss the various factors that can increase a person's risk of developing a UTI. These might include factors such as gender, age, sexual activity, certain medical conditions, and the use of certain types of birth control. Causes of UTIs. Go into detail about the various bacteria that can cause UTIs, and how these bacteria enter the urinary tract. Talk about how UTIs are diagnosed and treated, and discuss the potential complications that can arise if a UTI is left untreated. UTIs in different populations. Discuss how UTIs can affect different populations, such as children, older adults, and pregnant women. Talk about how UTIs are managed in these populations, and what unique challenges they may face. Prevention of UTIs. Provide tips for preventing UTIs, such as drinking plenty of water, urinating frequently, and wiping front to back after using the bathroom. Discuss other strategies such as cranberry juice and probiotics, and whether they have been shown to be effective. Recurrent UTIs. Talk about the challenges of recurrent UTIs, and how they are managed. Discuss strategies for preventing recurrent UTIs, such as taking prophylactic antibiotics or using vaginal estrogen therapy. By exploring these topics, you can provide viewers with a deeper understanding of UTIs and how they can be prevented and treated. Urinary tract infections (UTIs) can cause a variety of symptoms, depending on which part of the urinary tract is affected. Here are some common symptoms associated with UTIs. Pain or burning during urination. This is one of the most common symptoms of a UTI. It may feel like a burning or stinging sensation, and can be quite uncomfortable. Frequent urination. People with UTIs often feel like they need to urinate frequently, even if only small amounts of urine are produced each time. Urgency. A strong, sudden urge to urinate is another common symptom of UTIs. Blood in the urine. UTIs can sometimes cause blood to appear in the urine, which can be alarming. Cloudy or strong-smelling urine. UTIs can make urine appear cloudy or have a strong, unpleasant odor. Pain or pressure in the lower abdomen or back. Some people with UTIs experience pain or pressure in the lower abdomen or back. This may be a sign that the infection has spread to the kidneys. Fever and chills. In more severe cases, UTIs can cause fever and chills, which may be a sign of a more serious infection. If you are experiencing any of these symptoms, it's important to see a healthcare provider for diagnosis and treatment. UTIs can usually be treated with antibiotics, but left untreated, they can lead to more serious complications. The diagnosis of a urinary tract infection (UTI) typically involves a combination of a medical history, physical examination, and laboratory tests. Here are the steps involved in diagnosing a UTI. Medical history. Your healthcare provider will ask you questions about your symptoms, medical history, and any medications you are currently taking. They may also ask about your sexual history, as sexually transmitted infections can sometimes cause symptoms similar to those of a UTI. Physical examination. Your healthcare provider will examine you to check for signs of a UTI, such as tenderness in the lower abdomen or pain during a pelvic exam. Urine sample. You will be asked to provide a urine sample, which will be analyzed for the presence of bacteria, white blood cells, and red blood cells. Your healthcare provider may also perform a urine culture to identify the specific type of bacteria causing the infection. Imaging tests. In some cases, imaging tests such as an ultrasound or CT scan may be recommended to check for any abnormalities in the urinary tract. Once a diagnosis of UTI has been confirmed, your healthcare provider will prescribe an appropriate course of antibiotics to help clear the infection. It's important to take the full course of antibiotics as directed, even if your symptoms improve before the medication is finished. This will help ensure that the infection is fully treated and prevent it from returning or developing complications. Urinary tract infections (UTIs) are typically treated with antibiotics, which are medications that kill bacteria. The specific antibiotic prescribed will depend on the type of bacteria causing the infection and other factors such as your age, medical history, and allergies. Here are some key points to keep in mind when it comes to UTI treatment. Antibiotics. The most common type of antibiotics used to treat UTIs include trimethoprim sulfamethoxazole, nitrofurantoin, and ciprofloxacin. The length of treatment will depend on the severity of the infection, but typically ranges from 3 to 7 days. Pain relief. Over-the-counter pain relievers such as acetaminophen or ibuprofen may help alleviate the pain and discomfort associated with a UTI. Drinking fluids. Drinking plenty of water and other fluids can help flush bacteria out of the urinary tract and may also help alleviate symptoms such as burning or urgency during urination. Follow-up care. It's important to follow up with your healthcare provider after completing a course of antibiotics to make sure the infection has cleared and to check for any potential complications. Your healthcare provider may recommend repeat urine cultures or imaging tests to ensure that the infection has been fully treated. Prevention. To help prevent future UTIs, it's important to practice good hygiene habits such as wiping from front to back after using the bathroom, urinating frequently, and drinking plenty of fluids. It may also be helpful to urinate before and after sexual activity, as this can help flush bacteria out of the urinary tract. In rare cases, UTIs can progress to more serious infections that require hospitalization and intravenous antibiotics. If you experience symptoms such as fever, chills, severe pain, or vomiting, seek medical attention right away.